symptoms and causes of diabetes. In this section, we are going to look at what are the symptoms of diabetes, what causes type 1 diabetes, what causes type 2 diabetes, and what causes gestational diabetes, what else can cause diabetes. Let's look at what are the symptoms of diabetes. When we talk about the symptoms of diabetes, we find that some of the symptoms of diabetes include increased thirst and urination. There is also increased hunger and fatigue, blurred vision, sores that do not heal, unexplained weight loss. Symptoms of type 1 diabetes can start quickly in a matter of weeks. Symptoms of type 2 diabetes often develop slowly over the course of several years and can be so mild that you might not even notice them. Many people with type 2 diabetes have no symptoms. Some people do not find out they have the diabetes, they have the disease until they have diabetes. Related health problems such as blood vision or heart trouble. What causes type 1 diabetes? Type 1 diabetes occurs when your immune system, the body system for fighting infection attack and destroy the insulin producing beta cells of the pancreas. Scientists think type 1 diabetes is caused by genes and environment factors such as viruses that might trigger the disease. Studies such as the TrioNet are working to pinpoint causes of type 1 diabetes and possible ways to prevent or slow the disease. What causes type 2 diabetes? Type 2 diabetes, the most common form of diabetes, is caused by several factors including lifestyle factors and genes. Overweight, obesity, and physical inactivity. You are more likely to develop type 2 diabetes if you're not physically active and are overweight and obese. Extra weight sometimes causes insulin resistance, and in people with type 2 diabetes, the location of body fats also makes a difference. Extra belly fat is linked to insulin resistant type 2 diabetes and heart blood vessels diseases. To see if your weight puts you at risk type 2 diseases, check out body mass index. Insulin resistance. Type 2 diabetes usually begins with insulin resistance. Insulin resistance. Type 2 diabetes usually begin with insulin resistance, a condition in which muscles, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. At first, the pancreas makes more insulin to keep up with the added demand. Over the time, the pancreas cannot make enough insulin and blood glucose level rise. Genes and family history. As in type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. The disease intends to run in families and occurs most often in the racial and ethnic groups. What causes gestational diabetes? Scientists believe gestational diabetes, a type of diabetes that develops during pregnancy, is caused by the hormonal changes of pregnancy along with genetic and lifestyle factors. Insulin resistance. Hormones produced by the placenta contributing to insulin resistance, which occurs in all women during late pregnancy. Most women can produce enough insulin to overcome insulin resistance, but some cannot. Gestational diabetes occurs when the pancreas can't make enough insulin. As with type 2 diabetes, extra weight is linked to gestational diabetes. Women who are overweight or obese may already have insulin resistance when they become pregnant. Gain too much weight during pregnancy may also be a factor. Please make sure you subscribe to this YouTube channel and turn on your notification bell so that you can receive more updates. Thanks for watching.